It's great to be back in the electorate of Hawke. All of us in the Labor Party are jealous of anyone being the member for Hawke, it's got to say. A great Australian who, of course, one of his legacies is the creation of Medicare. Some 41 years ago, it took a Labor government to introduce Medicare. After the Whitlam government introduced Medibank, the Liberals came in under Fraser and got rid of it. Labor got re-elected, committed to re-establishing healthcare through Medicare, and then, of course, John Howard went to election after election saying that he would get rid of Medicare. They then, of course, changed their tune a little bit, but what they continued to do was undermine Medicare. But no one undermined Medicare more than Peter Dutton when he became Health Minister, and he tried to introduce a tax every time people visited the GP, so abolish bulk billing. He tried to introduce a tax every time people visited an emergency department and a tax on pharmaceuticals. But he also ripped $50 billion out of funding from the Commonwealth to the hospital system in 2014. When he couldn't get his way on the GP tax and other tax measures, he froze the Medicare rebate for 6 years, which led to a free fall in the number of free services. And he said very clearly and explicitly that there were too many free health services through Medicare in this country. This wasn't something that someone said early in their career as a thought bubble, as a backbencher. This is what he said as Health Minister. So you don't need an X-ray to see right through Peter Dutton's commitment to undermining Medicare, because that is what he has done at every single opportunity. And Australians simply can't afford the bill that Peter Dutton will force them to pay. Here in this Medicare urgent care clinic is just one of 87 around the country. At the last election, we promised to build and open 50 during this term. The fact is we've exceeded that substantially. And the great benefit of the 19,000 Australians who've been through this Medicare urgent care clinic at Sunbury is that all that they have needed is their Medicare card. They don't need their credit card. All they have needed is this little green and gold piece of plastic that is a source of pride for Australia. And already we've seen doctors here this morning, one of whom seen 3 young ones who have had accidents running around as kids do, and have been able to provide the care that they need when they needed it for free. Now, our commitment on Sunday to build on the success of what we did in our last budget, which was to triple the bulk billing incentive for 11 million Australians, such as people who were concession card holders or families with children, to extend that to all Australians. We know it will be successful because the decision that we made to triple the bulk billing incentive for those 11 million Australians has meant that 90% of them have been bulk billed, have seen a doctor for free. So we have the target of delivering 90% for the entire Australian population by 2030. This is the biggest investment in Medicare by any government since Medicare was created. By the way, the second biggest was the one we did in last year's budget. It is only Labor governments that will prioritise healthcare, prioritise education, dealing with cost of living pressures, whilst Peter Dutton continues to be negative and wage an ideological contest, which is what he would do when it comes to healthcare.